The nose, this small feature in the middle of your face, can completely change how you look and even how you feel about yourself. It's no wonder rhinoplasty is one of the most sought after cosmetic surgeries in the world. Welcome back to Reem Healthcast. Today we're talking about rhinoplasty. The nose is so central to our appearance, and even minor changes can make a huge difference. But what's really fascinating is that rhinoplasty isn't just about aesthetics. It can also address functional issues like breathing problems caused by a deviated septum.
Exactly. It's one of those procedures that blends art and science. Surgeons aren't just sculpting a nose, they're also improving someone's quality of life. And what's even more interesting is how versatile rhinoplasty is. Whether someone wants to reduce the size of their nose, reshape it, or fix a crooked bridge, there's a solution for almost every concern. And it's worth mentioning that rhinoplasty can also repair damage caused by trauma or even congenital deformities. It's not just about looking good, it's about feeling good and functioning better.
So let's start with the basics. What exactly is rhinoplasty? And why do people choose to undergo it?
Well, rhinoplasty is a surgical procedure that reshapes or resizes the nose. It can address a variety of concerns, both aesthetic and functional. For example, someone might want to refine the shape of a bulbous tip, narrow a wide nose, or repair a broken nose. On the functional side, it can improve breathing by correcting a deviated septum or clearing nasal blockages. And what makes rhinoplasty so unique is how personal it is. Everyone's reasons for considering it are different. Some people might want a subtle refinement, while others are looking for a complete transformation. It's about tailoring the procedure to the individual's needs.
Absolutely. And speaking of tailoring, there are actually different types of rhinoplasty, depending on the patient's goals and the surgical approach. Let's break those down.
Sure. So, one of the most common approaches is open rhinoplasty. This involves making a small incision across the columella, the tissue between the nostrils. This technique gives the surgeon better visibility and is often used for more complex cases. And then there's closed rhinoplasty, where all the incisions are made inside the nose. This approach leaves no visible scars, so it's ideal for people who need only minor adjustments. It's less invasive than the open approach, but it might not be suitable for everyone depending on the complexity of the changes they want. And then there's ultrasonic rhinoplasty, which is a newer technique. It uses ultrasonic tools to reshape the nasal bones. What's great about this method is that it's less invasive, often leads to less swelling, and has a faster recovery time compared to traditional techniques. And then there's non-surgical rhinoplasty, which uses fillers to temporarily modify the shape of the nose. It's perfect for minor corrections, but obviously isn't a permanent solution.
That's such a game changer, especially for people who might be worried about downtime or visible signs of surgery.
Exactly. Non-surgical options are great for people who only need very subtle tweaks, but for more significant deformities or functional issues, surgery is usually the way to go.
So let's talk about the procedure itself. What can someone expect during a rhinoplasty operation?
So, the surgery typically lasts between 1.5 to 3 hours, depending on how complex the case is. At Reem Hospital, rhinoplasty can be performed under either local or general anesthesia, depending on the patient's preference and the scope of the surgery. And the steps are pretty straightforward. First, there's the administration of anesthesia to ensure the patient is comfortable. Then, the surgeon makes the necessary incisions, either using the open or closed approach, before reshaping the nasal bones and cartilage. And if the patient has a deviated septum, the surgeon can correct that during the procedure as well. In some cases, they might also use grafts, like rib cartilage or ear cartilage, to augment or support the nose structure. Once the reshaping is complete, the incisions are closed and nasal tape or splints are applied to support the new shape and aid in healing.
It's amazing how much precision and expertise go into every step of the process. But of course, the surgery itself is just one part of the journey. Recovery is a whole other phase that requires patience and care.
That's so true. Recovery is a crucial part of the rhinoplasty journey, and it's important for patients to have realistic expectations about what that process will look like. For example, right after surgery, there's going to be some swelling and bruising, and patients will likely have nasal tape and splints to support the new structure. And during the first week, most people can return to light activities, but they'll still need to go back to the surgeon to have their splints and sutures removed. By the first month, a lot of the swelling and bruising will have subsided, although there might still be some residual swelling. And the final results of rhinoplasty can take 6 months to a year to fully manifest. That's because the nose continues to settle into its new shape, as the residual swelling gradually diminishes over time.
Now let's touch on something everyone wants to know. How much does rhinoplasty cost? Because that's often a big factor in someone's decision.
The cost can vary widely depending on the complexity of the case, the technique used, and the surgeon's expertise. At places like Reem Hospital, the pricing is competitive and usually includes everything from pre-operative assessments and the procedure itself to anesthesia, post-operative care, and follow-up appointments.
That's good to know. And speaking of surgeons, choosing the right one is absolutely critical. A skilled surgeon can make all the difference in achieving the desired results and minimizing risks.
Exactly. Patients should look for board-certified surgeons who specialize in rhinoplasty and have extensive experience. It's also a good idea to check if they're familiar with revision rhinoplasty, just in case a follow-up procedure is needed down the line.
And while we're on the topic of risks, let's be upfront. Like any surgery, rhinoplasty does carry some risks.
That's true. These can include bleeding, infection, and adverse reactions to anesthesia. There's also the possibility of swelling, bruising, and nasal stiffness. But the good news is that these risks can be minimized by choosing an experienced surgeon, following all post-op instructions carefully, and maintaining realistic expectations about the outcome.
So, how does rhinoplasty compare to other procedures like septoplasty or a nose lift? Because I think people often confuse these terms.
Great question. Rhinoplasty is more comprehensive and focuses on reshaping the nose for aesthetic purposes. Septoplasty, on the other hand, is specifically aimed at correcting a deviated septum to improve breathing. Sometimes the two procedures are combined if the patient needs both functional and aesthetic corrections. And a nose lift is more about elevating the nasal tip, whereas rhinoplasty involves reshaping the entire nose. There are also cases where additional graft material, like rib or ear cartilage, is needed for structural support, especially in more complex surgeries. And for those who aren't ready to commit to surgery, non-surgical alternatives using fillers can provide temporary results. But again, these are best for minor corrections and don't address functional issues like breathing problems.
So, who's a good candidate for rhinoplasty?
Generally, candidates should be at least 16 years old, older for more complex cases, and in good health. It's a personal decision, and consulting with a qualified surgeon is essential to evaluate your goals and potential outcomes.
So, whether you're thinking about a subtle refinement or a complete transformation, the journey really starts with understanding your options and choosing the right specialist.
And remember, recovery and realistic expectations are key. With the right guidance, you can achieve natural looking, lasting results and even improve your quality of life.
Couldn't agree more. Well, that's a wrap for today. A big thank you to our listeners for tuning in. We hope this conversation helped you better understand rhinoplasty. Stay tuned for our next episode where we'll continue bringing you practical, easy to understand health topics. Until then, take care and stay healthy.